Attention! Do you wake up at night to go to the bathroom? Do you experience cramps, cold sweats, a racing heart, or intense hunger? Be careful. These might be symptoms of diabetes that you should not ignore. In this video, we will explore in detail the 10 most important symptoms that could indicate the development of diabetes. You will learn to recognize these symptoms, allowing you to take quick action to protect your health and avoid serious complications. Together, we will identify these symptoms and find out exactly what to do about them. Number 1. Excessive thirst at night. It may seem normal to be thirsty after a few hours of sleep, but this is a symptom of diabetes. Excessive thirst, or nocturnal polydipsia, is one of the first and most common symptoms of diabetes. It occurs when blood glucose levels are too high and the body tries to eliminate the excess sugar through urine. Do you wake up during the night feeling very thirsty? Constant thirst could be a sign that your glucose levels are not in the ideal range. Studies show that some strategies can help, such as reducing carbohydrate intake, opting for meals rich in proteins and fibers, and staying well hydrated throughout the day. But excessive thirst is not the only nocturnal sign of diabetes. This vicious cycle of drinking more water leads us to symptom number 2. Number 2. Frequent urination at night. Waking up once or twice at night to urinate is not normal. Polyuria is the increased frequency of urination, a disorder associated with diabetes. When glucose levels are high, the kidneys work harder to filter and absorb the excess glucose. But when the kidneys can't absorb the excess sugar entering our bodies, the excess glucose is eliminated in the urine, taking more fluids with it. This increases thirst, starting a new cycle. Do you wake up during the night with the urge to urinate? Are you urinating more frequently, both during the day and at night? Reducing liquid intake 1 or 2 hours before bedtime and training your bladder by doing retention exercises can help. Polyuria could indicate that your glucose levels are out of control. Speaking of being out of control, the next symptom can cause a real empty feeling in your stomach. Number 3. Unexplained hunger, even after eating. Another nocturnal symptom of diabetes is polyphagia or hyperphagia, a constant hunger even after eating a full meal. If you find yourself rummaging through the kitchen at night looking for more food shortly after dinner, consider this a warning sign. This happens due to the relationship between the lack of the hormone insulin and the body's inability to obtain energy from food. Insulin is produced by the pancreas to allow cells to absorb and use glucose from food as an energy source. When there is an insulin deficiency or resistance to it, the body has difficulty moving glucose from the bloodstream into the cells. As a result, the cells don't receive the fuel they need and send hunger signals to the brain, as if you hadn't eaten, creating yet another vicious cycle. Do you wake up at night feeling hungry despite having dinner just a few hours ago? Be careful, as this can affect your weight and worsen glycemic control, increasing the risk of complications. But uncontrolled blood sugar levels also cause mood swings and changes in energy levels at night, which we'll discuss later. Studies show that consuming foods rich in fiber, protein, and fats, such as meats, coconut oil, nuts, and salads, helps control polyphagia. Not feeling satisfied after eating is bad enough, but the next symptom goes beyond discomfort because it involves severe pain. Number 4. Nighttime cramps. If you wake up with pain in your calves or legs, pay attention. These cramps are another symptom associated with diabetes that disrupts sleep and affects the quality of life. Nighttime cramps are a common symptom in people with uncontrolled diabetes. They usually occur due to imbalances in electrolyte levels and dehydration caused by high glucose levels. In hyperglycemia or high blood sugar, the body tries to eliminate the excess sugar through urine. However, by urinating more, you also lose important minerals like sodium, potassium, and calcium. This loss of minerals or electrolytes can lead to painful muscle spasms and contractions, especially in the legs. Many people with diabetes wake up in the middle of the night with intense cramps that make it hard to go back to sleep. Studies show some strategies that reduce nighttime cramps. Doing stretches and regular physical activity, as well as consuming foods rich in potassium and low in sugar, such as kiwi, avocado, spinach, and broccoli. If you frequently experience nighttime cramps, seek help to manage glucose levels and prevent these uncomfortable and painful contractions. Besides cramps, another symptom that can greatly disrupt your sleep is next on our list. Number 5. Night sweats. Waking up at night sweating, even if the room is cool, can be an alarming sign of uncontrolled glucose. Diaphoresis or night sweats is a classic symptom of hypoglycemia or low blood sugar and can happen while you sleep. When blood sugar levels drop too low, the body goes into fight or flight mode and releases certain hormones like adrenaline and cortisol. This reaction causes you to sweat excessively in an attempt to raise glucose levels. Waking up drenched in cold, clammy sweat is a warning sign, and in severe cases, this symptom can be accompanied by shaking, palpitations, dizziness, and even confusion. Avoiding alcohol consumption and managing blood glucose levels can help significantly. If you are experiencing these symptoms, it may be a warning that your glucose levels are fluctuating drastically, putting your health at risk. We will talk more about how to manage blood sugar highs and lows, but first, let's move on to the next symptom. Number 6. Blurred or altered vision at night. Have you ever woken up with blurry or slightly unfocused vision? This sudden change in the ability to see clearly can be a sign of diabetic retinopathy, which occurs when elevated blood glucose levels damage the small blood vessels in the retina. Very high or very low glucose levels can temporarily affect the eye's ability to focus and maintain clear vision. This happens because the excess or lack of glucose in the blood affects the way the eye lens curves, distorting the light's path and causing blurred or unfocused vision upon waking. Numerous studies show that maintaining controlled blood sugar levels and staying well hydrated can prevent episodes of blurred vision. The next symptom is literally a shock. Number 7. Rapid heartbeat during the night. Have you ever woken up in the middle of the night with your heart pounding and racing for no apparent reason? Nocturnal hypoglycemia, which occurs when blood sugar levels drop too low, induces the release of hormones like adrenaline and glucagon to try to restore glucose levels, causing your heart to beat very fast and hard. Nighttime palpitations are common in people with diabetes who use medications such as insulin. Waking up with a racing heart is not only scary, but also a symptom of glycemic alteration. Studies suggest some useful strategies, such as avoiding stimulants like coffee, soft drinks, alcohol, and strenuous activities close to bedtime. If you wake up with a rapid heartbeat, controlling glucose levels is crucial to prevent more severe long-term complications and to avoid the next symptom, which feels like your head might explode. Number 8. Headaches. Another nocturnal symptom that can indicate blood sugar problems is waking up with a headache. These headaches can range from mild to very intense and may be linked to glucose and hormone fluctuations during sleep. At night, if hypoglycemia occurs, the body may respond by releasing hormones like adrenaline and cortisol to try to increase glucose levels. But these can cause an increase in blood pressure and heart rate, contributing to the onset of headaches upon waking. Additionally, low glucose can lead to vasoconstriction, which is the contraction of blood vessels in the brain, another possible cause of headaches. On the other hand, if blood sugar levels remain high during the night, hyperglycemia can result in dehydration, which in turn can reduce the amount of fluid available to the brain, leading to recurrent headaches and affecting quality of life. Studies show that avoiding triggers like stress, irregular sleep, caffeine, dairy products, gluten-containing foods, glucose alterations, and dehydration, as well as practicing relaxation techniques, can help significantly. Waking up with headaches is a strong indicator of glucose alteration, and making adjustments to diet and lifestyle can help. The next symptom might seem strange, but science explains why. Rewrite your story with food as medicine. Lower blood sugar, lose weight, trust research-backed, doctor-approved methods. Download now. Number 9. Irritability during the night. Fluctuations in blood sugar levels can affect your mood, especially at night. When glucose levels are too high or too low, it is common to experience irritability, anxiety, and even mental confusion. These drastic mood changes can be another symptom of diabetes. Waking up at night extremely irritated for no reason or suddenly having crying spells could be a sign that your glucose levels are off. A technique that can help is to maintain a sleep routine, avoiding variations in bedtime and wake-up times, and engaging in relaxing activities before bed such as deep breathing, meditation, yoga, aromatherapy, and massage. Sleeping well and waking up with altered mood can be a sign of diabetes. Besides irritability or mood changes, the next topic is a real sleep disruptor. If you found this content valuable, please consider making a donation. Number 10. Sleep apnea and its relationship with diabetes. Repeated pauses in breathing during sleep, called apneas, can last from a few seconds to more than a minute and occur several times throughout the night. People with sleep apnea usually snore loudly and struggle to breathe. This causes frequent, albeit brief, awakenings, preventing restful sleep. This symptom can make glycemic control difficult because sleep interruptions cause physical and mental stress, raising levels of hormones like cortisol and adrenaline. These hormones increase resistance to insulin action and hinder blood sugar regulation. Additionally, sleep deprivation also impairs glucose metabolism, creating a vicious cycle where diabetes worsens sleep apnea, which in turn further disrupts glucose regulation. Some symptoms of sleep apnea include snoring, waking up feeling suffocated, waking up tired, difficulty concentrating, daytime sleepiness, morning headaches, and decreased sexual desire. Strategies that can help include maintaining an ideal weight since excess fat can obstruct the airways, avoiding alcohol, and sleeping on your side to prevent excessive discomfort from the tongue. If you identified any of these 10 nocturnal signs of diabetes, do not ignore them. Seek medical advice because the sooner diabetes is detected, the better the chances of controlling the disease and avoiding serious complications.